Hello, everyone. Today we are going to look at sexually transmitted infections. With that being said, sexually transmitted infections are infections that are spread from person to person through sexual contact. Each year, 1/4 of all new cases of STIs appear among 15 to 19-year-olds. 1 in 4 sexually active teens has an STI. Although many do not know it, most STIs are contracted through sex. The basis of this unit is abstinence. You cannot contract an STI if you do not have sex. What do you need to know about STIs? Most STIs are spread only through sexual contact. You cannot tell someone has an STI by his or her appearance. Most STIs have either very mild or no symptoms. Many STIs can be treated and cured, but early diagnosis is important. Because treatments of STIs vary, they must be accurately identified. STIs can occur because the body does not build up an immunity to them. STIs can cause sterility, blindness, deafness, and even birth defects. The most common STIs. The first one is chlamydia. This is the most common STI caused by a bacteria. This can be cured with an antibiotic. Males often experience painful, frequent urination and discharge. If untreated, chlamydia may lead to urethritis. Females the only symptom is a yellowish vaginal discharge. If untreated, chlamydia can cause serious infections of the reproductive organs called pelvic inflammatory disease, or PID. PID can lead to infertility or an ectopic pregnancy, potentially fatal condition, or a fertilized egg implants somewhere other than the uterus. Human papilloma virus, the most common viral STI. HPV causes no symptoms. Some people may not know they are infected. The body's immune system may destroy the virus, but some people with HPV remains in the body for life. The HPV virus that caused 70% of cervical cancer and 90% of genital warts. Genital herpes caused by a virus. This virus is known as herpes simplex virus. 1 out of 6 people aged 14 to 49 has had genital herpes infection. Genital herpes has no cure. Symptoms include painful blisters that appear on or around the genitals. Mothers can pass the genital herpes to their infant during childbirth. Genital warts are growth or bumps in the genital areas caused by certain types of HPV. Trichomoniasis, caused by a protozoan that affects the urinary tract or vagina. In males, symptoms include painful urination, a clear discharge, and some itching. Most males experience no symptoms at all. In females, symptoms include itching and burning of the vagina, an unpleasant smelling yellowish discharge, and pain when urinating. Gonorrhea is caused by a bacteria. It infects the urinary tract of both females and males. Males usually have a thick pus-like discharge from the penis and painful urination. Females sometimes experience painful urination and a pus-like discharge from the vagina or urinary tract. If left untreated, gonorrhea can lead to urethritis and infertility in males. In females, it may lead to PID and infertility. Infertility is the inability to reproduce. Hepatitis B and hepatitis C. These are sexually transmitted infections that attack the liver. They are also spread by blood-to-blood contact, such as when people share needles. The most common symptoms are fatigue, abdominal pain, nausea, and jaundice. May lead to cirrhosis. There is no cure. There is a vaccine for HBC, but there is none for HCV. Syphilis is caused by a bacteria that progresses through 3 stages. The first stage, a painless sore called a canker, appears at the site of the exposure. The bacteria may spread from the sore to different parts of the body. During the second stage, sores appear in the mouth and flu-like symptoms develop. A non-itchy skin rash often appears on the hands and the feet. In the third stage, symptoms may disappear for years. During this time, however, the bacteria attack internal organs and parts of the body, such as the brain and heart. Eventually, untreated, syphilis can cause brain damage, paralysis, and heart disease. This damage can lead to death. In its early stage, syphilis can be treated and cured with antibiotics. Al Capone contracted syphilis, which led to dementia and eventually his death. Pelvic inflammatory disease, or PID. Infection of the female reproductive organs and is caused by a bacteria. Most females become infected with PID as a result of contracting another STI, such as chlamydia or gonorrhea. If left untreated, PID may cause sterility. On a final note, the best way to avoid getting an STI is to obtain from sexual activity until marriage. As a teen, deciding to say no to sexual activity is one of the most important health choices that you can make. People who participate in high-risk behaviors should get medical checkups every 6 months. Individuals who suspect they may be infected should seek prompt medical attention. With that being said, I hope you enjoyed the show.